Hi, everyone, and welcome to OR Today webinars. We have a great presentation for you today featuring Amanda Heitman. Amanda will provide the novice to expert perioperative nurse considering embarking on the role of educator with information on the extensive role of the educator for surgical services areas. She will discuss the scope of how the functions as an intricate cog in the patient safety, staff safety, and quality initiatives and recruitment and retention efforts through an RN residency program in the perioperative arena. OR Today would like to thank our speaker, Amanda Heitman, a perioperative nurse with 18 years of OR experience, ready to help evaluate facility needs to develop and/or reestablish a knowledgeable perioperative team by providing a successful education model. For more information about Amanda and her education consulting services, please visit periopanu.com. For nearly 20 years, OR Today has provided perioperative and SPD professionals with up-to-date news and information about their profession. Our monthly magazine aims to educate readers about new guidelines, techniques, and equipment, as well as practical information for career building, problem solving, and overall well-being. To receive your free subscription to our magazine, please visit ortoday.com/subscribe. Today's webinar is eligible for one continuing education hour by the State of California Board of Registered Nursing. You can obtain your certificate by completing today's post-webinar survey. More details on this at the end of today's webinar. We'll wrap up today's presentation with a live Q&A. You can submit your questions at any time during the webinar by using the questions feature on the webinar dashboard. We'll get through as many questions as time allows. As I mentioned earlier, our presenter today is Amanda Heitman. Amanda, you may begin whenever you are ready.
Thank you so much. So thank you all for joining me today. I'm hoping that this speaks to several different avenues. Hopefully some of you out there are educators. Maybe you're new, maybe you've been doing it for a long time, or maybe you're an RN that's thinking about becoming an educator. And if anyone is out there that's in management and you happen to be listening to this, okay, go ahead and start looking at your budgets now for some new educators for your department. But let me just first start with a quote that I have in my office, and I got to take a look at this every now and then to remind myself that we're going to get through all this. Change is the law of life, and those who look only to the past or present are certain to miss the future. And that's from John F. Kennedy, and he knew that. And here we are in the midst of all of this change, and how are we going to move forward in that? Well, I myself have had some change in my life, as I'm sure all of you have. I grew up on a farm in rural Kansas and was blessed to know right away when I was young that I wanted to be a nurse. So I began in high school as a nurse aide, and then while I was in nursing school, I had the opportunity to work in labor and delivery as a nurse aide, and they decided they wanted to train me to help scrub C-sections. So I was very fortunate enough to be trained as a scrub tech, and I'm putting my hands up in finger quotes even though you can't see me right now, because they brought me right into the OR and they trained me in GYN procedures, and it was amazing to see all the background and what happens in the OR that I never even had any idea about. And then that helped me be able to be functional in the labor and delivery unit and doing C-sections. So needless to say, that started me in wanting to be in the OR, but you know, you don't always get those opportunities right out of nursing school. So I ended up working in dermatology for a while, but that helped me also because we did in-house surgeries. And so I learned how to assist and suture and then develop those patient education skills. And then that's where I began precepting. So I found the love of sharing my knowledge. Then after a few years, we moved to Iowa, and I got the opportunity of a lifetime in a small rural hospital. They weren't even looking for an OR nurse, and I just happened to come across there, and they saw my background and they brought me in, and they taught me exactly what perioperative nursing was all about. I got to learn everything. I learned PAT and PACU. I got to work in pre-op. I was given sedation and endoscopy and running those scopes and cleaning scopes. And we even had to rotate into sterile processing because we were so small. We had to learn it all. I worked with materials. And while doing all this, I was continuing to develop my skills as a circulator and scrub nurse. Now I knew change was coming again for me, so I immediately decided I better go get my CNOR so I could be more marketable. We were getting ready to make this big move. We were coming to North Carolina. And guess what? I happened to be 6 months pregnant with my third child, so I was very nervous and worried that I wasn't even going to get a job in the OR. But I ended up being hired on at a level 1 trauma center with 22 ORs, and that was pretty daunting. And then they hired me in the neuro cluster. Well, guess what? I didn't even have experience in the neuro cluster, but I was up for the challenge. And then after I got started and was a few weeks in, my educator actually came to me and asked me if I was willing to go back to GYN, that thing I loved the most, and work in there, that cluster with some ENT and general services. And I said I'd be happy to do that. And then I spent a few years there and then moved over to their sister hospital. And I've been there ever since. I started in that circulating role again, scrubbing, did some charge nurse for a while. And then I saw the need for an educator. They didn't have one. So I presented myself in that role, and I've been there ever since. So enough about me. Let's move forward with this. Now you know a little bit about me and where I've come from. Let's take a look at what I have going forward. An educator, what is it good for? So just let me share a glimpse of what educators are and why they're a vital source of the OR and why we need more of them. So looking at this title, please know it's definitely not like the song you might be familiar with, which is absolutely nothing. There is so much more that an educator is good for. ARN has even put out a position statement on the value of perioperative nurse educators. But it's surprising to me when I hear about hospitals that don't have a dedicated educator for the OR. They might have an educator that kind of does all over the hospital. And actually, I've even heard that that's the first position that they let go when they have struggling times. They say that they don't need an educator anymore. Well, I'm here to tell you why management needs to rethink that. Today, my objectives are to describe the importance of an educator role as an instructor, leader, and mentor, identify your resources available to guide a new or existing educator, discuss the significance of developing an RN residency program in your perioperative arena. So the pictures that you're going to see throughout my presentation are some of my former students and my children, so I want to thank them for allowing me to use them in my talk today. You'll see some of them in our skills labs, and of course, some of these are pre-COVID, but I love all of our skills labs that we did. To me, that's the best way to learn, not only because us educators love to get out of all of our fun toys that we've hoarded over the years, but it allows the students to take that time to get some hands-on in all of the things that they're learning in the classroom, in those modules, watching those videos. Most of us nurses are hands-on learners, so to me, this is the best way to get that knowledge to them. I also want to say I'm so proud of all my red hats. Now, this is what we call our new nurse residents in our program. We give them red scrub hats, so then they're identified as someone new to the OR. Because without experience, we know when we all look the same and we're behind those masks and all wearing the same scrubs, the expectations of us are all pretty high. But who needs to be behind them, supporting them? Your educator, of course. Perioperative educators are the foundation to any successful operating room. When I started in the OR, I didn't even know what an educator was. Again, I started in that small rural hospital. I had a supervisor and I had some preceptors that were kind of helping me learn the ropes. They gave me a guideline book and said, oh, go ahead and start reading that. That probably will help you a little bit. And then when I moved into the level 1 trauma center, I met my educator for the first time. And I was so amazed about what she did and how helpful and supportive she was and how much knowledge she had. To me, again, I saw her as a vital source of the OR. She was a resource to the whole healthcare system. And to me, that whole perioperative world. She had all these different relationships perioperatively. She had connections with peri-anesthesia areas like PAT and pre-op and PACU. She knew all about sterile processing, and she was familiar with endoscopy. She had relationships with the surgeons and anesthesia and all the other departments, including labor and delivery, cath lab, and interventional radiology. Educators are a resource for pretty much everything. And I know educators recently have been thrown into a variety of roles during this pandemic. And some of us have jumped quickly into this virtual world to provide our education and training instead of in person like we're used to, just to maintain our goals. AORN had a great article in their February 2021 journal, and it was very helpful to see that I wasn't the only one going through this and that we could support each other. So some of us have been an educator that has done all of these areas. Maybe you're small enough that you are already doing these things, or maybe you're being told that you may have to step into these roles, and that's okay. Remember, we can help each other. We can be the resource for each other. And is there a person in your department that's already doing these things? Is there an educator in the hospital, but you need someone specific for the OR? Or maybe you're the one that wants to do this. So what are some of the characteristics that I need to be getting in order to be that educator? Well, we as an educating society and nursing, we have to be so welcoming. We have to be supporting. We're in an environment where it's a very difficult and high stress area. So we have to provide that for all staff, new and existing. We have to be open for feedback. We definitely should be pretty confident in what we're doing, but get me, I know there's a lot of educators that maybe have less than 5 years of nursing, and that's okay too, because you learn as you go, you use your resources. You should be trustworthy and respectful, and then you should have some of those assets. Maybe you're already a current preceptor. Maybe you've helped with those initial competencies as the preceptor, and then maybe you've sat and started helping do checkoffs or annual competencies. Hopefully you're an AORN member, and if you're not, maybe you should look into that. Or have you just started out and you thought, well, my first step is I'm going to start doing and being a BLS instructor, and that's a great asset to have. But then you have to start also looking at your relationships and who you need to develop those with. Well, your staff, of course, you need to be out there working with them and making connections with them. And surgeons, again, they want to see that you know what you're doing, right? Because you're training their staff. And then, of course, management to build that relationship with the education so you can move forward. So you're teaching and you're a leader and you are showing yourself to the entire hospital that you are a part of the OR. So you have to be that calming resource sometimes, and when it's all chaotic, you have to think about something that's moving forward and what is the next step. If I'm the educator, what do I need to do now? I need to start developing some skills. I need to probably, maybe if I'm not great at it, work on some public speaking. Right out of the gate, we are pretty comfortable speaking. We speak up a lot in the OR, but that's a little different. I'm doing it right now, so it can't be that hard, right? But I've kind of been doing this for a little while. I guess I started when I was young. I was a 4-H'er, I did FFA, I took a speech class or two, and you might just have to start reaching back to those times and start practicing more, start talking to your families and giving presentations to your dog. But go online, go onto YouTube, take a look at some TED Talks or Toastmasters and see what you can learn from those. And then you can start small. You can start with your in-services and start developing that public speaking. And maybe when the first few times you have an in-service, you don't even speak too much, you get an expert in there. Maybe have a sales rep come in and let them take over the in-service, or have a team member that's the service coordinator take the lead. You're going to also need some professional development. So you can go to AORN. They're a great source for that. They work closely with CCI, and they have a really nice program called Perioperative Educator Certificate of Mastery. And it has a lot of different elements for those educators that are either starting or have been going for a while that just need some more components and educational help to continue in growing their department and their foundation. And then you probably will need some requirements. So if you're not a BSN, you better start thinking about working on it, and then also getting your CNOR, because you want to be the person that is the professional and showing that you have that development. So CNOR is a good way to do that. But sometimes you're thinking about, okay, I can't afford to do all this. I can't go back to school. There's just no way. Now, stop and take a look. There are options for this too. There's tuition reimbursement opportunities. Maybe you can get that from your hospital you're working at, or take a look at ARN and see if there's any scholarship opportunities. So now, besides working on yourself, you have to establish that educational foundation. Start communicating with your leadership on the needs of the department. I'm sure they have a lot of things that they can share with you, issues that have come up that are high risk, high volume, incident reports that are coming in. And then you can look at those and try to help facilitate educational opportunities for the staff. Again, working closely with sales reps, they're the experts on their products, so bring them in there and just let them demonstrate and show how to use something. Use your service coordinators, because they're out there and they're seeing and bringing in new products, and maybe there's different procedures that need to be explored. Work with your staff to figure out what those needs are. Are there new services you're getting ready to start in your OR that you haven't done before? Or again, going back to management, are there policies that staff are lacking in and things that need to be readdressed and re-educated in some of our processes? Try to start small, start simple. You just need to start dedicating some time to educate, right? Because we have a lot to accomplish. All of these things I just mentioned, there's a lot. And so you got to step up to management and say, listen, I need to have some time to do all this. Can I at least have once a week to have some time where we have this dedicated for education? And they get upset and they say, oh, no, we don't have time for that. We got to keep going with our cases. But then you have to promote and reassure them that it's going to be beneficial, not only for your staff, but even for them. Give them one of those weekly in-services so they can talk about budgeting and how you're doing well or what you need to work on. But being an educator doesn't just mean the only thing we do are competencies and in-services, even though that's what it looks like. There are a lot of things that we do behind the scenes that we deal with every day, like quality improvement. We are looking at all of these things and we're trying to find out, again, what can we help staff with? We're looking at timeout processes. We're looking at infection prevention, these evidence-based practices that we do every day, and just making sure we're following in the right direction. So sometimes we have to put together audits to do this. An easy one that you can start with is a documentation audit to just double check that your staff are functioning the way they should with that. Implants and tissue and medical devices are really sometimes difficult for staff to keep consistent with and make sure that they're doing that effectively. So that's an easy one to jump into and start doing that with your staff. And sometimes it's easier for these things to be coming from an educator. So when you have something to present to the staff that says it needs to be corrected, I think that coming from an educator, I would be a little less intimidated than my manager coming in and telling me that you did this wrong and you need to fix this. So, hey, that's another reason why educators are important, right? And then maybe you could be on a committee for the hospital or develop a committee specifically for your department to focus on these things. Because you know that these go beyond the OR. Sometimes they're, again, creating things onto the floor with infection risks. So we have to step back and look at the safety things. Where are we going and what are the things we need to readdress, like our national patient safety goals? Maybe we're not doing the best that we could with these things. And then simple things that we deal with every day, but we know are so important, are our specimens and counts, those routine surgical items. Believe me, that stuff happens. And so it's okay to take the time to bring that stuff back to your staff's attention to readdress it and work on it more. And I know staff love all of these audits that we come and do, and they're constantly worried about us coming in and checking in on them. And I know that's a lot for the educators to do too, and we sit here and wonder, how am I supposed to do all of this when I'm in staffing? because some of us are still in staffing while we're doing all of this. And my advice to you is just to lead by example. Provide the best patient practice consistently and demonstrate that and show your staff that you're doing that. And what are your resources for that? Your AORN guidelines. You know what you're supposed to be doing, so follow those guidelines. That's best practice, and our Joint Commission requirements. So those are the easiest things to do. But believe me, staff freak out when the educator or somebody important comes into the OR. They call me Nurse Ratchet, and it's okay. It's a term of endearment for me because I feel like they're paying attention and and working hard, but they get nervous and then they get upset because then they have to start doing things the way they're supposed to, and and I'm thinking to myself, well, wait a minute, you guys should be doing this all the time, not just because I walked into the room. We know what we're supposed to be doing. We know what best practice is. This stuff is not new to us, but we need to remind ourselves that who does surgery every day? We do. So when the surgeons push back on things that we know we're supposed to be doing, like, hey, the count's wrong, we better check it out, or hey, you need to stop for this timeout, they don't want to hear it. And I know that's true in all ORs, but you have to lead. You have to be the example. You have to take charge, because those docs don't do surgery every day. We do. And that's why we're there, is to be the professionals and be patient safety advocates. So while you're out there and you're seeing people working, start looking for the others that have the same mindset as you. Okay, the other nurse ratchets out there, start supporting them, and then they will support you. And then encourage them for their own professional development. Are they CNOR yet? Do they have their CST? And then looking into those other areas like pre-op and sterile processing and endo, do they have their certifications? Encourage them. Help maybe coordinate a certification prep course for them to get them going in that direction. I know sometimes when I'm in the OR, I also get asked questions, and believe me, I don't know everything. I'm not an expert in everything, but I do reassure them and tell them that I'm going to find out and get back with them. And so again, you have to be able to go back and forth in that role, be the educator and be clinical. And again, encouraging leadership opportunities. When you're seeing staff out there that are doing a great job helping someone, step up to them and ask them if they've ever thought about being a preceptor before. Maybe they didn't think they could because they haven't been in the OR very long. Well, we know right now there's a lot of us that are less than 5 years experience again. And so it's okay if you see that that person is doing best practice and willing to share that. So encourage them. Maybe there's somebody that really knows that schedule and they know how to manipulate and work with the staff to keep things moving like they should. Encourage them to go into the charge role. Or maybe there's somebody that's really dedicated to a specific service and they really like that service. Help them become a coordinator, and you work closely with them again in your in-services. And maybe there might be an educator just sitting in the wings waiting for someone to talk to them and encourage them to move forward in that direction, or even management for future references. Believe me, we just have to be out there and supporting each other. And I know it's hard because we don't have the answers to everything, but we have a lot of resources, and you are always ready to use those. If you're not an AORN member, start looking into that, because then you get access to some of their free things once you're a member, like AORN guidelines essentials. Now you have to purchase AORN guidelines themselves, but maybe your institution wants to do that. So it's a resource for everybody in the hospital. As OR staff, we know AORN is kind of like the Bible of the OR, right? I'm doing my air quotes again. I wish you guys could see those. It pretty much has everything we do and how to do it. But now, in the last several years, it's giving you the research to support what we do, instead of, oh, well, that's just the way we've always done it. There's no real reason. Here we go. Just do it anyway. They have that information there. But we have to remember that these are guidelines, okay? They're not Joint Commission requirements. So sometimes they're not as easy as you think. So when staff stop you and say, okay, so what does AORN say? What are we supposed to do? Tell me. Sometimes it's not as black and white. Sometimes you have to just say, well, actually, they tell us that we should sit down and discuss it and form a committee and then let us as a facility make that decision and build the policy for it. And they're shocked by that because they really want somebody to tell them what to do. But we know what our practice is and how we can perform that better. But we use ARN as that resource. And sometimes it's really hard to read a guideline. If you've done that over the years, there's a lot of information in there, and sometimes you want to just get the meat out of it. Guideline Essentials is that. And again, that one's free for ARN members. It has PowerPoints for in-services, example policies, frequently asked questions, and then quick how-tos for staff reference with pictures and everything. So it's a really nice resource to get started with. ARN also has toolkits, which are great, like fire safety and correct site surgery to help work on some of those efficiencies. And then when you're a member, you get that free ARN journal that has tons of CE opportunities and lots of clinical topics and research articles about what we do every day. But I know when I grab my journal, what I flip to immediately is the clinical issues, because those are the things that I'm dealing with every day, and I want to see what everybody's talking about and how we're supposed to help with those. Then they also have great webinars on OR topics, and of course, ARN Global Conference and Expo. So if you've never been, start thinking about that, but I have to tell you, it's one of the greatest things I've ever experienced. It's so amazing to go out there and see all of us like-minded people in one place and looking at all of these new technologies and seeing all this great education and networking with other people. That, again, it's just so motivating to think we're all focused on the same thing, patient safety. So if you ever have an opportunity, please check that out. And then some of us are still old school and we like to have our textbooks and things to look it up. Those resources are still out there. And then if you've got new grads that are coming in, they're used to textbooks, right? So continue to give those to them as resources. And Alexander's Care of the Patient in Surgery is a great one for that. And it's constantly being updated with things that we're doing and changing. Essentials of Perioperative Nursing by Goodman and Spry. And then the Pocket Guide to the OR is a nice one for, again, new nurses that have never really had a lot of experience in the OR and just kind of need to know even what the surgeries are that we're doing. And then I know some of us are all way too busy for all of this, okay? I don't have any time for this. I don't have any time for meetings. I can't go to a conference. I don't even have time to read a research article. Forget it. Well, OR Today is for you then, okay? So this is great because you get a free magazine. You don't even have to pay for anything, and you get free webinars. That's even better. So their magazine I love because it's just a quick read. It's got great aspects from all kinds of perioperative areas, and it's got current topics, but it even also supports the balance of our day-to-day stressors. Their section of Out of the OR is awesome. I really like that because it helps you think about fun things like traveling and recipes, and then how to deal with all of our emotions and stressors every day. And then they have nice spotlights on people like us that are in the OR every day and what they're doing in their careers to help, again, motivate us, which is what we all need, right? But they also have these amazing webinars that I mentioned, like this, that are free on all kinds of topics. And actually, I've never attended an OR Today conference, so I'm really excited about attending one of those soon and getting to see all their education that they provide and start networking again myself. All of this is getting so much easier. It's there, it's out there, it's virtual. Get the continuing education that we need. There's so many options available. So reach out to others who know what we do. Stay connected. And you can do this right now at work. Get out there and circulate and scrub. Stay up to date with what's happening clinically. What are the day-to-day needs? So then you're out there and you see, oh, where'd that piece of equipment come from? I didn't even know we had that. We better have an in-service on that. So you can see firsthand what staff are asking for. And then ARN, again, stay connected with them, join. They have all of these educational opportunities and professional development. Start being more involved in your professional world. Look for those opportunities to network. ARN has an educator specialty assembly for nursing educators specifically, and they sit down and discuss topics that directly relate to us. And how wonderful is that to not have to reinvent the wheel and just go out there and talk to someone that can guide you. OR Nurse Link is great. You can communicate with other nurses, again, on topics that you have questions about. And then you have to reach out to other nurses and new generations. We're starting fresh, right? So there are blogs out there and podcasts that are really great, that are sharing things that mean something to us in the OR. It's kind of nice to start seeing and hearing things that relate to us and what we actually do every day. So Circulating Life is a great blog. ARN has a blog called the Periop Life. And then there's a great podcast out there that you can listen to on your way home or way to work every day called First Case. And it talks about what we do. And now that we've gotten connected, we need to share our knowledge. Start precepting. As educators, we teach and share our information all the time, but you need others to encourage to do the same. We cannot have this mentality anymore of eating our young. We must give them all of our knowledge so they can help take care of us someday, or just at least let me go on vacation, okay? I don't think we can keep the old mentality of telling Dr. Smith, hey, you can't post any cases this week, I'm going on vacation, because you know, I'm the only one that knows anything around here. We can't do that anymore. We have to teach others what we know. We have to share our skills. We have to provide rationale of what we do. So I can't just tell you to do something and you think that you're going to remember it and do it perfectly every time. You got to tell me why you do it that way so I can retain it the next time. Now, all of us, again, you know, just because we can teach it doesn't, and we're experts in what we do, doesn't always make us great preceptors. Believe me, I know that. So you have to find the person that has both. And then also you got to talk to management so they can help you with this, because precepting is a lot, okay? And so when you're asking someone to do this on a day and day after day, they want to see a reward for it, right? So hopefully management can give them some sort of monetary thank you for all of their extra efforts. And then sometimes we just need to talk to somebody. Talk to somebody about our crazy day. All right, I want to do it out of the OR, get me out of here. I want to go with someone and just have a cup of coffee, because I know our families love to hear all about our crazy OR stories. They just don't get it. They don't understand what we do. And you need mentors out there. And precepting and mentoring is not the same. Mentors are there to support emotional and physical needs, okay? Not teach necessarily, but you want to support them with your experiences. Tell them stories, and then they'll relate and think, oh my gosh, you did the same thing I did. And you're going through the same experiences. Give guidance to them, help them professionally. And then when they see what you're doing in your career, that will motivate them in their own career. Over the years, I always get asked what I enjoy the most about the OR. And to me, it's because we can learn something new every day. And now that we've finished our work day and we're ready to get out of here, clock out, go home, we can't stop yet. We have to tell our story. So what are you passionate about? What are the things about the OR that are important to you? Talk about them. Get it out there. Write for professional journals and magazines. OR Today and ARN, and I know there's more out there, but just start somewhere. There are topics specifically to the OR that we know we're very passionate about, like smoke evacuation and RN circulating bills in some states. Write letters, speak to legislation on these topics, get out there. Then start presenting locally. Go to an ARN chapter meeting and present. Go to an ARN regional meeting and present, or national meeting for something. Do an in-person talk or a webinar kind of like this. I am a passionate perioperative nurse, and I always felt like I wanted to share that, and I know you do too. So find that thing and get out there. So this picture that you're seeing is actually my son a few years ago. It was about 3 years ago when he was a junior in high school, and he is an avid soccer kid. But I have a wonderful OR mom story that I'd like to share with you. So my husband and I were out of town on a trip, actually out of the country. And when we called one night to just check in on the kids, grandma was watching them. We talked to our son and he's talking about his day. And then all of a sudden he asked me, he goes, Mom, how do I know if I have a collapsed lung? I'm like, what? What are you talking about? Why? Did something happen in soccer? Did you get hit? Are you okay? He's like, no, I just took a deep breath and I felt a pop. And I'm like, you're fine. It's probably nothing. Told him just take some ibuprofen, go home, go to bed. It'll be fine in the morning. Well, my son was smart and did not listen to this mother. And he went ahead and made his own appointment at the pediatrician for the next morning. And then his grandmother called us that next morning and said, okay, well, they found out, they did a chest x-ray and they think he has a collapsed lung and we're going to go ahead and send him to the emergency room. But me, I'm still thinking, it's a pediatrician office. They don't even know how to read a chest x-ray. They don't see all that stuff all the time. He's fine. But I went ahead and called my OR manager at the time and just gave her a heads up and said, hey, can you sneak over there and check on him, just make sure everything's okay? Well, long story short, this poor kid did have a collapsed lung. He had a spontaneous pneumothorax and he needed a chest tube and then surgery. So my husband and I jumped on the next flight and we had him in surgery that next week. But the reason why I'm telling you this story is because while all of this was going on and I'm doing phone consents on a boat in the middle of the South Atlantic, I was calm and cool because I knew my OR team was there handling things. We were taking care of our own because we are family in the OR, right? And we know that we treat our patients just like we would want our own family to be treated consistently. So I had no worries that he was going to be taken care of. All of us know that we probably spend more time with our OR staff and peers than we do our own families. So we really kind of are like family. And we have to be the best and we have to be on our game all the time. And again, no one really even knows what we do behind the scenes in the OR. So we have to get out there and show and tell, make it fun. What do we do? What happens when you go to the OR? We are so unique in what we do. So get out there. If you've got young kids, go to those elementary schools and start presenting to them. Bring fun things in. Ask that educator. She'll love to get all her hoarding supplies out and share them with you. So take them in and put them in gowns and masks and show them fun things and let them see that it's not a scary place. And then start speaking to middle schools and high schools to engage them in nursing. And then again, specifically OR nursing, because hey, they're getting ready to go to college and what do I want to do for the rest of my life? That might light that fire. So here are my two girls when they were very young, and we used, back in the day, pre-COVID, could do open houses in a side OR and bring in the community and our family and friends. And it was just so fun to see their faces light up when they see all of these things that we do that nobody else sees. And it's like, oh, wow, you guys really do things back here. But it was also a way to get out there and recruit people and show them what we do. So that's your next step. You've got to get out there and promote the OR. Bring them in. And you've got to get into the colleges and the university settings. Now, some of them have already started some OR specific curriculums, but there's just not enough. And as an educator, you can totally do this. Just email some instructors, let them know that you've got some opportunities for them. We can get back to this eventually. Now, we were doing it all before and letting them have observational opportunities and even preceptorships for a few weeks. And that was wonderful too. But maybe you could do a virtual meet and greet and just give them a quick overview of what the perioperative world is about. I used to do this in person and guest lecture once a year to the nearby schools to just give them a quick glimpse about what we do. We talk about timeouts and things like that. And then at the end, I would give them an AORN brochure that they have that you could just hand to them and say, well, here's some information about a career in the OR and beyond. And again, light that fire to see, oh, hey, I didn't even know this existed. Maybe this is something that I want to do. Hey, I should tell my friend that's getting ready to graduate that, hey, have you ever thought about going to the OR? They have these great programs now. You don't have to have experience. They can train you right out of school. And then the word is out. And then even invite these students to AORN chapter meetings to see what that's about and how well we work in the communities and what we do give them free education, and then let them know maybe you've got scholarships for them, and that will be a way to bring them in. We have to be ready to build the future. No one else is going to do this but us. We have to establish our residency programs. So we need a new grad or a new to the OR program, and ARN can do that for you. They have a great program called Periop 101, and it has all the curriculum built right there. They have it specific for different areas like ORs and ASCs and OBs, and it has the guidelines specifically that you're training them on. So it gives them the rationale of what they're doing, and that's so important. They have computer modules, videos, required readings, and then you need that educator to incorporate those skills labs and the checklist that they give you. So I want you to keep in mind that this is not going to be easy or quick or cheap, especially for those management folks out there listening. Please also don't think that your educator can just teach a dozen new nurses and then everything's going to be fine and it will just get right back to normal. No. You have to make sure that they're getting the continued support that they need once they're on their own, because you want to retain them. You want them to be continuing to build. And again, this is going to take time. This is going to take years, okay? But what you will gain is so great. You're going to gain more preceptors, more mentors, more leaders, and then hopefully an educator or two out there. So let me share with you something out there that can help. Periop anew. So this has an opportunity for someone to come and review exactly what your hospital specific needs are. It's a well-rounded perioperative influence. They can help you with OR residency programs, compliance and safety. It's moving you into the right direction. And educators need help too in their role to make them successful. So basically this is a preceptor for the educator. It's helping them facilitate to get your department back to that new normal. And then it has a residency curriculum that works. It helps remove that task nurse mentality. And it creates nurses that have the rationale that helps them develop that critical thinking. And then it has the versatility that can help them become better circulators by allowing them to have interdisciplinary collaboration. So they're learning other roles, like the scrub role. And I think that's a wonderful thing to train nurses in. Not only does it give them the versatility, but helps them anticipate in that circulating role. And I love my surgical techs and my RNFAs because they're my experts and they help support them and help precept them. But then you can also kind of think about cross-training into other areas like peri-anesthesia with the pre-op PAT areas, endoscopy, sterile processing. Let them have time to go behind the scenes and see what anesthesia does and the value of what they do for patients. And then this program also allows them to have time with the support staff, with PCTs and anesthesia techs, because they need to know it's all about a team effort and in our environmental care. And then even OR billers, okay, behind the scenes, what's happening. Give them some time with that so then they know on the bottom line what happens if I don't charge for this. Now, I know right away we're all dealing with all these challenges and all these changes, but we all need to remember that most of us are, think we're all crazy? Well, no, that's not really what I mean. Are we all OCD? Well, maybe. I know we're all probably type A, but we all are caring. We are caring for a patient when they are the most vulnerable. We are confident. We're not afraid to speak up for our patients. We want to be the best at what we do. We're professional. We do this for a reason. It's not just a job, it's our passion, our calling. We are leaders. We step up and ask questions. We take initiative to correct those things and provide best practice. We are advocating for our patients and working together as our team to keep them safe and provide the best patient outcomes possible. We are nurses. We are one of the highest regarded professions in the world. But OR nursing is a specialty and it takes more time to learn. There are so many aspects to it, like our surgical conscience and positioning and prepping, just to name a few. And again, you don't get those things in nursing school. Those skills and that knowledge is necessary, and you have to build that with an OR nurse that has a way to structure it. So In the end, what you need to rebuild the foundation of the OR is an educator leading the way. So thank you all for joining me today, and happy Veterans Day to those of you out there. I want to thank you all so much for your service. And happy Perioperative Nurse Week next week. That's an exciting week for us, so please take some time to celebrate your greatness. And if you have, if you found anything through this talk that you relate to, please share it with everybody, share it with your peers, maybe share it with management. Maybe they will find something that they found that they can work with too. And then go advocate for yourself. Advocate for your OR team to be their perioperative educator. Maybe you need to show them that this is the next step for them. So here's a quote that I like to refer to: never believe that a few caring people cannot change the world, for indeed that's all who ever have. And I just want to thank you for all of what you guys do every day. I'm going to leave you today with another one of my favorite quotes. It's from Florence Nightingale, and again, I have this in my office to just take some times that I need to reflect. Unless we are making progress in our nursing every year, every month, every week, take my word for it, we're going back. So thank you so much again for your time, and I really hope that this is helpful for everyone to move forward in the future. Does anybody have any questions?
Thank you so much, Amanda, for this great presentation. I would like to remind the audience that if you have a question, you may submit your questions through the questions feature on the webinar dashboard. We do have a few that have come in, and we'll start with those. The first one, Amanda, is, so say that you have recruited and you have several candidates to choose from. How do you pick the best one or the right one?
Well, that's a really good question, and that is sometimes a daunting task because there are a lot of influx of applicants sometimes, but you kind of have to be selective in the questions that you ask them when you're doing interviews. You want them to know why they want to be in the OR. So you don't want to just take somebody that thinks it's cool because they watched Grey's Anatomy and, oh, I really want to do that. And believe me, I've been fooled before by these people that say the right things and it isn't really what they thought it was. So you just have to, I guess the best thing to do is to find the people that really know that it's about patient safety and that that's the reason they're doing it, and start from there.
All right, our next question is, right now there are a lot of travelers in the operating room. Are we ever going to be able to get away from that?
Yeah, that's a really good question too. And yes, I'm feeling that right now in a lot of ORs. But as I get as an educator, when I get travelers in, basically the first thing I do is treat them like they're my own. I don't treat them like a traveler. I train them just like my permanent staff, and I try to make sure that I'm welcoming again and bring them in as a part of our team. And I want them to build relationships in the OR. Again, they're the ones taking care of our patients, so I want them to be there for the right reasons. And then if they see that welcoming environment and that your OR is doing the right things and our best practice, then maybe they'll want to stay. We've had that before where travelers stay, or they end up coming back to you when they're done traveling. So that's my advice, is to, I know we're going to have them around for a while, is to just try to harness that and show them that you have a really great OR, and maybe they will come back. As a permanent staff person, I should say.
All right, our next question is, as an educator, what is your biggest challenge?
Mine personally is preceptors. So it's not my personal difficulty, but it is specifically for what I'm trying to accomplish. So if I don't have a preceptor that's going to support the things that I'm teaching as an educator, especially in my residency program, then I'm not going to get very far. And that's what I also have to make sure people understand is I can't just have all of these people coming in and I can teach a dozen people and everything's going to be fine. They have to have the clinical time with a preceptor providing the patient care that's going to make them retain the information I'm telling them. Because if your preceptor goes, oh, it's fine, you don't have to do any of that. Yeah, I know she told you, but don't worry. Then that's a problem. So it's difficult. And so you have to be able to have that preceptor that's going to support you. That's a great question.
All right, our next question is, what educational requirement do you consider appropriate for an OR RN educator? And then in parentheses, they offer BSN versus MSN.
Well, I would, it probably may depend on the institution specifically, but I think BSN is where everyone is going. I don't think that we can make it be an MSN requirement because that's just not out there. That would be wonderful if that is an option to get a candidate that has that. But I think, again, we are struggling right now with people that are willing to do this. I really am hoping that institutions start looking at having more than just one or two educators. And I think, again, going back to that traveler question or how to get staff to come back to the OR is you got to give them leadership opportunities. And I know sometimes traveling is attractive because of the money. This might be a way to get them in and keep them to stay if you're going to give them a little bit more, but give them more responsibility. So an education person may not have that master's degree if they're coming in from the outside. Now, can they attain it eventually? Maybe, but I think you just need to start with a bachelor's.
All right, you sort of touched on this with a previous question, but I'll go ahead and ask. The OR that I currently serve as an educator is going through a lot of changes where many staff are leaving and we are hiring nurses with no OR experience. How do you have staff be more open to precepting to new hires when they have never precepted before?
Yes, that is a difficult challenge. Again, you have to make that decision as the educator to pick the right preceptors. And I guess depending on who you're trying to train, if I'm training my residents and new grads that are going to be permanent, I'm really going to focus on those preceptors that are also permanent and that are willing to put forth a little bit more effort, knowing that they're going to be staying with them. That's the worst thing for a preceptor is to put in all that time in teaching and then the person just leaves. It's very disheartening. And so you've got to be selective in your preceptors. Now, right now I'm dealing with having to use travelers as well as for precepting, and I have to be selective on that. So I actually kind of do my due diligence and get out there and watch them and see how they perform to make sure I'm choosing the right ones. But sometimes that's tough because if you have a lot, you may not have enough to choose from. But please make sure that you're working closely with leadership on the assignments for things and not just kind of hope that you cross your fingers and that it all works out. Because if you get an orientee that doesn't have that right preceptor, they may step away from it altogether and say, this isn't for me.
All right, I think we have time for one more question, and that is, how do you get staff, managers, leaders buy-in for Periop 101?
Well, I was lucky enough that they had already done something similar in the ICU and saw how successful it was, so it was easy to come in. My suggestion is to help them, again, understand that this is going to make it easier for the educator because it's already structured and available. The options used to be when you bought periop or new that you had seats that you could purchase And sometimes when you purchase seats and you don't fill them necessarily with residents, we use them for our permanent staff. And that was helpful for giving re-education to the permanent staff. So it's not just focusing on bringing in new staff without experience, but it can help re-educate the ones that are already there. So it's kind of a twofold thing that you can use it for, not just things, staff that have never been in the OR, but you can start to do it from scratch, but I would hate to have to reinvent that wheel. And it gives you so many different aspects, like I mentioned, that are so helpful to help train. And as the educator, you're going to have plenty to do besides that with the skills labs. So this is the easiest way to get the structure. And the rationale, that rationale is important, because if they don't know why they're doing something, they're going to forget it. And they're not going to have that critical thinking skill that grows and grows as you're an OR nurse, because they're going to be like, oh, I don't know. They told me I just have to do this. They don't know why they're doing it. And that's what Periop 101 has, is that rationale.
All right, thank you so much, Amanda, for a great presentation. I would like to encourage everyone to visit Amanda's website for periopanew.com to learn more about the services that they provide to our industry. A quick reminder to our audience that you can obtain your certificate by completing today's post-webinar survey. The survey will be emailed to you 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE hour, and you'll be able to download the certificate once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back soon with another webinar. Please visit ortodaywebinars.live for more details and complimentary registration. Thank you all and have a wonderful afternoon.